Okay, so one of the markers that we look at whenever we're working with any patients is function. Okay, how well are they functioning, how well are their capabilities? It's not always based on pain. Pain isn't always kind of the marker of whether you're healthy or not. We have some professional athletes that we work with who are in pain every day because they're training every day. They're constantly pushing their bodies to the next limit and getting their bodies to adapt. So when you're having treatment and you're getting your body to adapt to a new normal or a new way of function, sometimes that can be uncomfortable. So pain's not always the marker of kind of whether you're healthy or not. But one of the things we do look at is function. And when we look at, specifically in Ash's case, when he first came in, we looked at his straight leg raise, how well he was able to move his leg. And when he first came in, what was it? Kind of, we were about here, and it was like, It was all pain, and he wasn't able to move, and there was a lot of limitation with kind of the mobility. There was tightness in the tissues. It was pulling all the way in his back. Now, if we look at his straight leg raise, okay, we're able to get him much, much further without causing any pain. Are you feeling anything when we're doing that?
It starts about there. The tension really starts about there.
Yeah. But that's huge,
which was down there.
Yeah, that was huge. Before, we were getting tension going all the way up into his spine from literally around kind of 15 to 20 degrees. Now, we're getting, you know, almost to kind of 90 degrees where we should be. And although there is a little bit of tension, obviously we're still in the process of his program, and I think we're going to need to carry on doing more work with him. He's going to need to carry on kind of adapting his tissues. There's such a big difference in his mobility. And let's have a look at this side as well.
Yeah, because this is the one where I had the nerve pain right down there.
Yeah. So this one was the worst one.
Yeah.
And again, that movement is there. And one of the things people often do is they shy away from what hurts. Okay, and especially when it comes to musculoskeletal issues, back pain, that's not always the best approach, right? Unless you've just had a car accident or something, that's a different scenario. But when you're dealing with lower back pain or chronic pain, you know, shying away from the movements which cause your pain is actually going to make you worse. It's going to make you weaker in those planes of movement, and it's going to make the restriction that you have increase. So, you know, you've got to push through that a little bit. I always say that the graph is a graph that goes up and down. So you have pain levels that go up and up and up. Sometimes the more you move closer into a particular pain, it hurts. But then you get over that mound. Once you come over that, it just gets better. Okay, so this is something you need to remember when you're, you know, if you're struggling with this and you're trying to recover through this. Just a little tip. All right, let's get you sitting up.